Well, ladies, there are parts of being a woman that are just simply amazing. Little things like getting all dressed up to go out for a night on the town to more grand things like becoming a mom. I love that part of being a woman. But being a woman also means sometimes enduring the big changes our bodies go through, especially that one big change, menopause. These days, more women are talking openly about the menopause symptoms they're experiencing, but often women may not even know that's what they're feeling and that it's simply a part of their body changing. And so today, as part of our ongoing My Wellness series, gynecologist Dr. Richard Conlen is joining us this morning with his insider's guide to menopause and some tips on how to comfortably cope with the symptoms. Dr. Conlen, good morning. Good to see you.
Good morning, Danielle. How are you?
I'm good, thank you. Doctor, what exactly is menopause?
Well, menopause classically would be described as when you have stopped having your cycles for 1 year. It is the cessation of ovarian function, the decreasing of estrogen production.
Okay.
But the symptoms can vary quite a bit. Many of them will include insomnia, hot flashes, mood swings, weight gain, lack of energy, depression in a very mild form. And the average age being the onset of somewhere between 48 and 52.
Okay. And the other thing that I was startled to read is that sometimes it can start as early as in your 30s?
Yes, it is not common, it is fairly rare, and many times it can be secondary to an underlying medical problem.
I got you. I do want to talk a little bit more about perimenopause here in just a minute, but we have all heard the horror stories. My mother, oh my gosh, the stories she told me about what she went through when she was going through menopause and the hormonal changes that she went through. Is it always an uncomfortable experience?
There's a great deal of variety in the type of symptoms, the timing. For most people, there's a mild to moderate amount of discomfort. For some very fortunate people, they have no symptoms, an occasional hot flash for a few months, but for others, it can be quite devastating to their lifestyle.
Why do some women experience these kind of hormonal changes earlier than others?
Well, if you mean like as in their 30s or in the perimenopausal time, every month when you cycle, the ovary makes a different egg and a different level of hormone.
Okay.
So there's a great deal of variety throughout that. In the younger women, it can be secondary to maybe exposure to chemotherapeutic agents if they had significant diseases in the prior to 30, whether they have thyroid problems or chronic illnesses through childhood that have manifested all the way up into their adult life.
You know, it's interesting because we actually spoke to a woman who's struggling to cope with her own symptoms of menopause, and this is Terry's story. And the thing is, we have a feeling that it just might sound very familiar to many of you out there watching this morning. Let's take a look.
About 45, 46 is when the symptoms started, which was you're tired, you're foggy. I had places that itched constantly, like right here on my chest was a constant itch, although there was no rash or anything. Had hot flashes, just miserable. Very short temper, could get set off very easily, which was very unlike me. I'm usually pretty laid back. And unfortunately, I had a 4-year-old son who was going through potty training. So menopausal mommy and a potty training child don't go well together. So I went back to my OB/GYN and she prescribed a synthetic hormone. And it helped a little bit, but it didn't help. I still was not feeling good. I wasn't myself at all. Also, a friend of mine had been to an endocrinologist, and so she suggested I go to a hormone doctor. Did a bunch of blood work, and it came back, and I realized I had absolutely no estrogen whatsoever in my body at all. So he then prescribed bioidentical hormones.
No estrogen at all. Wow, incredible. Well, when we come back, we're going to find out what helped her. It's a solution that may help many women out there who are dealing with symptoms of menopause and perimenopause, so don't go away. Welcome back. Well, still with me this morning is Dr. Richard Conlen, offering an insider's guide to menopause and some modern solutions. Now, right before the break, we met Terry. She is a lady who's struggling with some of the more difficult symptoms that come with the change, as some women call it. And, you know, Dr. Conlen, now I want to talk about solutions. I know a lot of women out there are interested in this. What are some of the ways that women can cope with these symptoms?
Well, first of all, the main thing that we must always consider is general health. Okay. So therefore, exercise, proper diet, staying away from all the bad foods. There's everything from over-the-counter herbs to complete hormone therapy.
You mentioned hormone therapy, also known as HT, but I have to tell you, I have heard just an awful lot of controversy surrounding HT. Why?
Well, the controversy surrounds is breast cancer. Taking hormone therapy may increase your risk for that disease, and therefore the cornerstone for prescribing HT revolves around getting people on the smallest amount of hormone to get the maximum amount of relief, and of course then close follow-up and reevaluation. But there are other alternatives that can be done short of HT.
So what do you recommend to your patients?
I recommend a FDA-approved product, of course, and I prefer estrogel. Estrogel is a plant-based bioidentical estradiol, which is very popular in Europe, which is an outstanding product. It takes care of most of all of the symptoms. It's simply applied. It's a transdermal, or it goes on the skin. It performs very nicely.
Bioidentical, what does that mean?
Bioidentical means that it is molecularly identical to what the body makes.
Got you. Now, is this available only by prescription, or can you get it over the counter?
No, this is prescription, and I must say that they should see their healthcare provider for a good physical examination and a history prior to starting any type of hormone therapy.
Well, we asked Terry how estrogel worked for her, and here's what she had to say.
He suggested estrogel. People put it on their arm. That's what they do. And it has alcohol in it. It takes a little bit for it to dry. So, I'd always do it after I take a shower. 1 squirt a day, and I do progesterone 10 days out of the month. I feel good. I feel great. So you have to eat well and exercise, and then this has helped me feel balanced.
Well, I have to tell you, I like that balance that she's achieved there, and she seems like she's found her solutions. Dr. Conlen, I want to talk about a gel. Why a gel over other alternatives?
When you apply a gel to the skin, it goes right into the bloodstream. Now, it may be quick in acting to relieve the symptoms, but the most important thing is that it bypasses the liver and is generally safer than any medication that is taken by mouth, with the additional benefit that the dosage can be much less.
Okay. Well, I have to tell you, really good information this morning. Thank you so much for coming by and sharing this with us.
Thank you.
Appreciate it. And of course, if you want more information on estrogel, simply head to the website. It's estrogel.com. And as the doctor said, always discuss with your own healthcare provider what's best for you.